Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep and look at what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Welcome to another Mulready Minute podcast. We're glad you're joining us. We have with us today a guest who I owe an apology to. We had our very first attempt. We had some technical difficulties on our side, not on his side. And so, in today's day and age and all that's gone on, that's not all that unusual, but still very frustrating. So thank you for coming in person. So I feel like we need one of those clapperboards. Take two. Right. Sal Gentile is the CEO of Friday Health Plans, and Friday Health Plans is a new entrant into the Oklahoma marketplace, offering individual health insurance plans. And so we have a number of plans being offered. We're not going to parade through every CEO of each company. I just thought it would be interesting to hear from someone who is a new entrant and kind of how that came about and where they're going and that sort of thing. So let me quickly just introduce you to Sal. He founded Friday Health Plans to transform the health insurance market. With more than 30 years of experience in high-growth, innovative companies, Sal brings a deep experience in operational leadership, market strategy, and business development. Sal is a graduate of Pace University, where he majored in math and computer science. And before going live here, we were just talking about math and my own son and his daughter, who are sort of in a math field. So, Sal, good to have you with us. Thanks for joining us.
You bet. Thanks for having me.
Okay. So when I was elected, we had 2 health insurance plans here in Oklahoma. Mm-hmm. And actually, a couple years prior to that, we had only one. And thank God we had one that hung with us. There were many counties across the country that had no options in that marketplace.
That's right.
We go from 2 when I was elected 2.5 years ago to next year, we will have 8 options out there. Mm-hmm. Help me understand just what's the dynamic? What do you think has changed that has allowed those new entrants into the marketplace or encouraged them to come out here to Oklahoma?
Yeah, I think a couple of important factors. The first one, probably the most important to underwriters and actuaries, is the market's just stabilized. Yeah. And so, that which was an uncertain market, which, risk takers don't like is in the insurance industry, is the uncertainty, became more certain. We could predict the market on a year-over-year basis. And so I think that was a primary one that is more generic. I think more specifically, you had a lot of headwinds specifically around the ACA after it passed. It was challenged in the courts. You had an administration that came in that was trying to have it overturned. And so, a lot of headwind that, said to people, maybe we'll just sit on the sidelines and wait to see what happens. And then I think once that threat passed, it became, okay, stable markets, no headwinds from an administration or a court trying to turn over the law. It just made it an inviting sort of marketplace.
Yeah, good to hear you say that, because when I've been asked that, that really has been my answer to, is just the stabilization factor, that it just has stabilized. When it first opened up, a lot of unknowns, actuarially and otherwise. What's that demographic going to look like? Who is going to come into that plan and those subsidized plans? So, and then I think to the other different factors that you just mentioned. So, in the insurance industry, no business likes risk and unknown, right? But even more so in the insurance world. Yeah. So tell us then a little bit about Friday Health Plans and yourself and the launch of Friday Health Plans and who they are.
Sure. Well, and thanks for that introduction. My background would not have normally led you to say, hey, let's start a health insurance company. But when you think about, the ACA and, the fact that, under the law today, you have to spend 80 cents of every premium dollar on health care, which I think is a really solid plan. It really allowed for those who could be more efficient at operating a health plan to drive out unnecessary cost in the system and deliver value to members in the market. And that's what we strive to do at Friday. Our model is fairly simple. We don't have lots of options. They're fairly straightforward. And our goal was to provide value in the marketplace. And so we saw the market as needing more choices, and so we wanted to enter the market to provide more choice to consumers. And our differentiated product is that we offer unlimited primary care, unlimited mental health. We really believe in primary care bending the cost trend in healthcare. The more people use primary care, the more they stay out of the hospital and avoid ER visits that are costly to members and insurers. And so that was our driving factor, and then our background being technology geeks that could be administratively efficient. We could drive that cost out, and the combination would drive down premiums. And so what you'll see in all the markets we serve, we're amongst the low cost, if not the low cost provider of insurance, because we can drive all of those unnecessary costs out. And that's really what Friday is all about.
Yeah, driving those efficiencies. So you mentioned primary care and really trying to drive primary care outside of lower co-payments or unlimited visits. What are there other things you guys are doing to try to drive the primary care visits and encourage that?
We are. So a few things. One, we're making it easier to access. Like we believe so much in the power of primary care that we were one of the early adopters of telemedicine. And so we allowed our members to utilize telehealth long before it was mandated in any of the markets.
Before it was cool.
Before it was cool, exactly right. And then the other thing we do is we work with our PBM, our pharmacy benefit manager, and we have created a formulary where we now have over 5,000 preferred generics that are zero cost. So for us, a typical engagement with a member, right, they can go to a primary care doc, get a prescription, have it filled. As long as they take one of those generics, they can have a $0 out of pocket. So it makes the copays and deductibles irrelevant for them, and that is 80% of the market. Right? They're not chronically ill. They're not on a drug or seeing a specialist every day. They're relatively healthy, but they have a sniffle or whatever, and so they go to the doctor, and so that's kind of one of the things that we do. I think the other thing that we do is, we work with network partners, and we are transparent. We show them what the cost is in the underwriting and say, hey, look, if you want to attract ACA members into your hospital, this is the price point, and it gives us the opportunity to negotiate transparently with the hospital system, what those price points need to be. And we've found very willing participants in many markets to help us meet the price point that we think will attract more people into the ACA.
Okay. I want to circle back to that network point in a minute, but a little side note, just this morning, funny timing, dark 30 this morning on my way to the gym, I was behind a bus, a city bus, with an ad on the back, said zero generics, Friday health plans. That just was kind of ironic.
Well, that's good that the marketing's working.
Yeah,
there you go.
Doing Sal here in a couple hours. So you mentioned your use of tech to drive efficiency and that sort of thing. When I've been out speaking publicly, I talk a lot about the evolution of the marketplace, individual health plans, and how we've now got tech companies moving into the insurance space. But you also have insurance companies that are using technology. I think you guys are probably falling somewhere in between there and that use of technology. And any comments on the evolution of that? And when I say it, everyone knows Blue Cross Blue Shield and United Healthcare, but we've now got entrants in our marketplace of named Oscar and Friday and Bright, and that people don't know on the tip of their tongue.
I think what's happened in the transition in this industry, right, is in order to reduce cost at the employer level, we created this thing called a high deductible plan. We'd created co-pays and co-insurance, and so we asked consumers, whether they were in a group plan or as individuals now buying health insurance, to bear some of the cost burden in order to make it affordable. And yet we gave them no real tools to navigate the healthcare system, right? And so that was the gap in the early 2000s. And what we aimed all to do with technology was help close that gap, help people navigate the healthcare system, whether it's more easily find a doctor in the network, more easily get information about the prescription drug plans or the benefits or what have you. And so, when we think about technology, we, on the back end side, processing claims and customer service, we try and make it more efficient to take cost out, because that's cost I don't then have to underwrite and pass along in premium. The other thing we do with technology is change the experience for the member, make that experience as sort of hassle-free as possible, so that they can get the care they need without worrying about, is it going to be covered? Am I in network? Is the drug going to be paid for, and that thing? So that's where we aim our investment dollars in technology.
Okay. And so it sounds like, I don't believe you're marketing it that way, but you guys have sort of created a hybrid sort of approach from an HMO and a PPO. Would that be accurate? I mean,
it is.
Some of the best of an HMO, but without some of the, hurdles maybe, or
that's
would
right.
that be accurate?
As you know, we're officially licensed as an HMO, but we're an open model HSO. Right. It's a self-referral even to a specialist, so you don't need a primary care doc that's named. You don't have to have that, and if you need a specialist, you can go to a specialist as long as you stay in network. You're covered. So that's exactly how I would describe it.
Okay.
And and even our clinical investments around helping our members stay healthy or get the right care at the right time is done using technology to make sure that we're getting people where they need to be and when they need to be.
So you've mentioned multiple times networks. Mm-hmm. Tell me about your experience. You were coming in cold in the state mm-hmm. of Oklahoma, building that network. You mentioned you've been able to secure some good partners in there. Tell us kind of what that experience was like, and then what is the network made up of here in Oklahoma?
Yeah, I'm in Tulsa. I know. I'm embarrassed to say I don't know the name of them. I know it's the Saints and the Aints, and we have the Aints. But
that's my line.
I would have to get back to you on who the partners are. Hillcrest.
Hillcrest is
yeah.
the
Okay.
System,
yeah. And in general, when it comes to network, for us, it's like every player. We have to meet federal adequacy, right? We have to have enough hospitals and enough doctors in each discipline to satisfy the federal government, and of course, your office is around that. And so our goal, 2 years out from when we enter a market is, can we meet the price point, and will we have willing network participants? Because that's really the product at the end of the day. And we found in both Tulsa and Oklahoma City that it was open to new entrants, and we had a lot of bidders for our product, and we were able to find partners that enabled us to enter the market.
Good. So I know you're based in Colorado.
Mm-hmm.
But I know it's not in Denver. I can't
mm-hmm.
remember exactly. It's a small, but let's talk about where you're from and your staffing and employee base and maybe future plans of Friday Health Plans.
You bet. It was interesting. We intended to launch the product greenfield from start, and yet in the state of Colorado, in rural Colorado, in a little city called Alamosa, which is south central Colorado, we found a health plan that was in some financial distress, but otherwise had outstanding people operating the health plan. And so we worked with the commissioner in Colorado at that time to take over that health plan. So instead of launching greenfield, we launched by acquiring a health plan, and that's how we got to Alamosa. I'm from Denver now, and as is my business partner, so our corporate headquarters are Denver, but the vast majority of our operation is in Alamosa still.
Which is southern Colorado?
Yeah, about 40 miles from the New Mexico border in south central Colorado. It's called the San Luis Valley. And we have just about 300 people there now doing customer service and claim processing and medical management, and it's a wonderful place. College town, Adams State University's there,
Okay.
Yeah, just a wonderful place.
I need to visit when I'm in Colorado.
Absolutely.
Next.
You get to see the sand dunes, the great sand dunes of Colorado.
Okay.
They're rather amazing.
Now, one other caveat in the individual marketplace, and especially timely at this stage, is Medicaid expansion, because
mm-hmm.
that's new for the Oklahoma marketplace, small m,
mm-hmm.
but as well the impact on the marketplace, capital M. So
mm-hmm.
Talk to me, if you would, about that as you guys considered that, and Medicaid expansion was on the ballot. It now is in place and is rolling out this year.
Yeah,
talk about that for a minute.
Sure. Well, for one, I think it's great for Oklahomans in general. It gives them another option. Our experience has been in prior years. You would expect two outcomes. One, the Medicaid members tend to be just a little sicker, so you probably get a slight benefit on the medical cost side of the ACA now. That population will get slightly healthier, which will help on the cost side going forward. It'll bend the cost trend a little bit, but it will also shrink the size of the market. Those would be general rules of Medicaid expansion that we've seen in other markets. But an interesting thing sort of playing out right now, there's so much tailwind for the ACA marketplace. We saw a fair amount of growth in 2021 because of the extra stimulus on subsidies. We saw about a 50% growth in our plan from January through August with the extended open enrollment period, and I would expect something similar happened, in Oklahoma. And then just the number of people who left corporate America and have gone to the gig economy has changed the landscape of health insurance. So our bet is that while you might have a slight decrease in your total ACA population, it won't be as big as it might have been if this happened pre-COVID. And that because it's now sort of occurring post-COVID, there'll be a shift in the marketplace. But my guess is the growth will, from all those other factors, will offset some of the erosion into Medicaid. And we'll see. We'll see how it works out. But that would be our bet as we think about the ultimate outcome.
Okay. So as we're wrapping up here, you are currently entering into 8 counties, and thank you for that. More offerings. When I was campaigning for this office, I talked about choices for Oklahomans. I'm a free market, competition's good kind of guy. Competition increases efficiency, drives innovation, drives down costs, that sort of thing. So thank you for that. But tell me about future plans in Oklahoma or elsewhere, both as far as growth, geographical growth or growth of product lines, or what's Friday Health Plan's plans?
Yeah, you bet. And, it's growth in all areas. Our mission and vision statements have choice as their primary component. We want consumers to have choices in America. And, our goal is to meet them all with Friday Health Plans as a choice. So geographically, we're currently in 7 states, including Oklahoma, and are adding 5 more for the 2023 plan year. And our goal is to get nationwide. It'll just take us some time to get there. Oklahoma, we are in the 8 counties, but intend to expand. We're working with our network team and our broker sales team here to figure out exactly which counties would be the most right ones to go to next. And we'll continue to expand. Our goal in every state is to ultimately get statewide. And the only gating factor is building the network. We got to get the network partners aligned. As it relates to new product development, I would say our first pivot from the ACA individual and small group market is likely Medicare Advantage, because our consumers will age into Medicare. About 25% of our consumers today that use Friday Health Plans are over age 55. So as they age into Medicare and are comfortable with Friday Health Plans products and services, we want to be able to maintain that relationship. So we think we're probably 3 or 4 years away from that, but as our members start to age in, we will likely pivot towards offering Medicare Advantage plans. That would be the next logical step for us.
Yeah. So others are aging into that market. You and I are not.
No. For us, we're locked in at our current, young age. That's exactly right.
I wish. Okay. Well, I did forget to mention, and you just mentioned the 8 states, but Colorado, Georgia, Nevada, New Mexico, North Carolina, Texas, and the great state of Oklahoma, your current states. So expanding into 5 more, did you say?
5 more: Missouri, Tennessee, Pennsylvania, Virginia, and Florida.
Nice.
So we're keeping it busy at Friday Health Plans.
Okay.
Yeah.
Well, good. I think that wraps up our time. Sal Gentile, we want to just thank you for joining us, giving us some insight in what it's like to enter a new market, as well as insight into Friday Health Plans, on who is Friday Health Plans and where they're going. So we really appreciate you joining us this morning.
You bet. It was great to be here.
So that wraps up our latest Mulready Minute podcast. We thank you for joining us, and we'll look for you next time.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about on this podcast. Until next time, take care from the Oklahoma Insurance Department.